Could I join you?
Recording in progress.
Okay, thank you. Good evening, everyone. Welcome. I believe this is actually a regular meeting of the Programs and Services Committees, at which we're mostly doing budget items. So Wednesday, May 8th. Good evening, everyone. From the committee, joining us at the start of the meeting, from Ward 1, Councilor John Oliver. From Ward 3, Julia Maliki. I'm Josh Princeman, Ward 4, Councilor at Large, Chair of the committee. Ward 5, Vice Chair of the committee, Councilor Bill Humphrey. From Ward 6, Councilor Alan Lopovitz. And I think that's it from the committee at the moment. We're also joined by Councilor Susan Albright remotely. I see a number of our esteemed city officials here with us. Perry Rosenfeld, Seth Bai, COO Jonathan Yo, Commissioner Linda Walsh, and Shini Lau from Phoenix Public Schools. We have a few items to get to before the budget items. And then, so we'll go through those first, then we'll get to the budget discussion. And I will try to acknowledge other people as they come in. First item is item 220. Sorry, we're also being video and audio recorded, so watch yourself. First item on our agenda is item 226-24. This is a resolution to declare June 9th, 2024, George Mansfield Day. Folks had the text of the resolution in their packets. As folks probably know, George Mansfield was a longtime alderman and a phenomenal Newton resident who many of us will miss greatly. We are joined by former Alderman Kenny Parker. Did you want to speak for a couple minutes about the resolution?
I'll just real briefly, I guess.
Okay, briefly.
Yeah, so I had the honor and privilege of serving with George for my entire 18 years on the City Council, then Board of Aldermen. George was, I'd say, the ideal of what you want in an elected official, in that he could disagree without being disagreeable. He was thoughtful, considerate, and had a lot of useful stuff to offer in various discussions, whatever the topic was, seemed to have useful things to offer. But he wasn't so caught up in his own view that he would be closed to listening to different opinions. And so I think it's a really terrific trait to see. It wasn't, what I would call brittle in his views. He would, I see some people seem to be at least on the net, not anyone on the local level here, of course, but on the national. But he would, but also he went out of his way to help people. He was a ward councilor or ward alderman, it was called, from Ward 6, the Newton Center, Newton Highlands area. And George, I think this was before email, most of his service. There was email in the later years, obviously, but literally fielded thousands of phone calls and emails over the course of his time in office. And he wouldn't just take the call, he would go to the place where the problem was, and everything from, potholes to major policy issues affecting the schools and the infrastructure of the city. At various times, he chaired almost every major committee of this council. He chaired public facilities. I believe at the time that the new main library was being worked on, but I didn't verify that, so I didn't specifically say that in the resolution. He chaired the finance committee, and for the last number of years of his service, he chaired the land use committee. He also served for 8 years as the vice president of the Board of Aldermen, and I think to all who served with him was respected, loved, and admired. And I've never heard anyone say a negative thing about him. And just a terrific human being too. And we're just, in terms of what we're trying to do, obviously this resolution, I don't know if it'll be read in some way but the idea would be on June 9th. Why June 9th, people may ask? That's Village Day in Newton Highlands, where of course he lived, and is where his daughter still lives. So we would have the plan is to have a table at Village Day with some pictures and some other things celebrating George's life. We'll also be dedicating a bench to him. Anyone who wants to donate to support this, donations are very much welcome. If someone wants to donate, John Rice, who runs the Hyde Community Center, is coordinating that effort, but they could contact me. I'm Ken Parker, so they could email me, ken@kenparker.org. I'm sort of helping to pass the hat to support the bench. So yeah, emailing me is probably the best way to say, that you'd like to donate, and I would figure out the logistics, basically. So thanks. Great question, Councilor Lovitz. And the other thing that we're going to do is, so when the bench is eventually dedicated, which will be one of the Fridays when there's films being presented in Newton House, there'll be a good crowd there. That's over at, the bench will be over by the Little League field, essentially, in High Playground. And so that'll be right there where the concerts are. So there'll essentially be there are breaks in the concerts anyway, sort of at an intermission. I mean, it'll be concert, movie, whatever it is, in conjunction with that. This was John Rice's idea, and I think is a great way of handling it, so that there's really two pieces to honoring George, the Village Day piece, and then the piece again on the day, which we don't know the date yet, when the plaque is ready and all that sort of thing.
Thank you very much. I want to just quickly acknowledge from the committee from Ward 2, Councilor David Mickley, who's joined us. Welcome, Councilor Mickley. And Councilor Albright, I see your hand up. Please go ahead.
Thank you very much. I have no objection to this resolution, but during my time on the board, council, I guess, Sal Salvucci passed away. He had been chair of the Public Facilities Committee and a longtime member of the council, and Jay Ciccone, who at the time of his death was the chair of the Public Safety Committee. And I'm just wondering, is this a new precedent that maybe we should think about honoring all of our counselors who have served, or aldermen, former aldermen who've served for a long time and served the city well, in some kind of way. I just wanted to see if that was a point of discussion for this committee.
Thank you. Councilor Albright, did anyone want to weigh in on that?
May I make one comment on that? Right. I think that's a fabulous point, that there are others who are very much worthy of honoring. I would think specifically of Brian Yates, who passed away a few years ago. And I mean, I guess it just so happened that I was talking with Lyle, Councilor Baker, and with Councilor Laredo at the wake, and we had this thought about doing this. But it in no way suggests that there aren't many other people worthy of this. And I think if this became a precedent, I see no downside to that whatsoever. So I think that's a great suggestion from Councilor Albright.
I would agree with that. I think there could be a few criteria there in terms of either length of service or something along those lines. I don't know, but it does make sense to me to, have some sort of, is the word standard? I'm not sure, for that kind of honorarium.
Thank you, Councilor Albright. And as we folks probably saw, there was a docket item on the council rules, and I didn't submit it for tonight. That's my fault, but I will be sending around a memo formulating that subcommittee to work on the rules. And it's something Councilor Oliver is actually going to be chairing that subcommittee. Spoiler alert, sorry about that. So Councilor Oliver, maybe let's keep that in mind as we go through the rules subcommittee. Maybe it's a topic that could be appropriately placed within the rules.
Makes sense.
Any other discussion or motions? Like a motion to approve would be in order this time. Councilor Oliver has moved approval 226-24. Any discussion?
I just want to add that George was our board councilman, alderman, many years. We've been residents for 40 years, and ever since I can remember, just a gentleman, a person, caring, very caring, a person. So I'm glad you came up with this. Thanks.
Thank you. Any other discussion? Okay, all those in favor, please say aye. Aye. Those opposed? Any abstentions? Okay, that's 6-0. Thank you.
Thanks very much. And thanks for inviting me up.
Thank you. Thank
See you
you.
all.
You're welcome to stay for the rest.
Oh, you know what? I just realized.
Next item is item 192-24. This is her honor the mayor requesting authorization to transfer $85,000 for HHS nursing staffing. Commissioner Walsh, are you here to tell us about that?
I am. Thank you very much, Chair. I came before you a couple of months back for this same type of expenditure where we continue to have to use a staffing agency for the school nurses in our schools. We are still recruiting. We are hopeful to find some excellent school nurses. We are not alone in our quest to try to find nurses. School nursing is a difficult role to recruit for, but if any of you have had any medical procedures, appointments, or interface in the last couple of months, you might notice that people are talking about it almost everywhere we go. There is a serious nursing shortage. So it is not our desire to use an agency. We are lucky that we do have an agency that specializes in hiring people that are certified and or knowledgeable about school. So we're happy to have them. This is a stopgap measure. So in order for us to continue to pay the agency for the school nurses, we need to transfer the money from one line item out of our personnel salaries, since we're not using all of those, into this other line for temporary staffing. And I want to emphasize temporary. This is a temporary measure, but unfortunately still a challenge for our department here. But this will get us through the end of the fiscal year. So thank you.
Thank you, Commissioner Walsh. In my day job, I work in healthcare. I work for Boston Medical Center Health System, and I can attest to the fact that there are ongoing challenges with nursing. And more hospitals are dedicating more and more of their budget to traveling nurses and temporary nurses. And so I appreciate the fact that this is not a new expenditure, but yet a transfer, much the way many hospitals and other healthcare organizations are having to do. Councilor Oliver.
Yeah, my only question, and yeah, I think you answered half of it right there, Commissioner, is what's the time frame for this? If it goes through the end of the fiscal year, what time frame does this cover?
Till the end of the fiscal year, till June 30th.
Correct. And when would does it start tomorrow? Did it start 2 months ago?
It'll start as soon as this order becomes, I don't know if you call it verified or ratified. We are okay right now. We have enough money in that line item week to week, so we're paying our bills. But we will require this additional transfer to continue to use the agency until the end of the school year, which is the end of June.
Right. So this then would be roughly 2 months.
Yeah. Yes, sir.
And how many different people would this be for?
3.
3 people. Great. Thank you. That's all I had.
You're welcome.
Thank you. I just had a question about the differential in hourly rate. If you were to translate an annual salary of a school nurse to an hourly rate, what is the difference between the rate for a temporary and a permanent nurse?
The rate is much higher for an hourly rate. That, of course, isn't all to the nurse either. It is some of it to the agency. It's an interesting calculation that I don't have in front of me because, of course, if we have full-time nurses on staff, you're talking about benefits and other related expenses. So it's not just about salary. But if you're looking dollar to dollar, it is much more expensive to staff with a school nurse from an agency than it would be our own employees on an hourly rate.
Can you give a ballpark on that, or?
Well, just like magic, Ruth Hoshino, the director of school nurses, appeared before me. Ruth, how much per hour do we pay the agency for school nurses? And she's our director of school health services. Say hello to the counselors.
Hi, everybody.
Thank you for joining us. I don't know if you missed any of the questions you were transferring from attendee to panelist, but basically we're just trying to assess the difference between sort of a full-time school nurse and the hourly rate, what's the disparity and what would be sort of the hourly breakdown of a full-time employee, permanent employee, excuse me, and the hourly rate for the temporary nurses we're having to supplement with.
Can you hear me?
Yes.
Okay, because I've lost all of my ability to see you.
We're not messing with that, don't worry.
The hourly rate for our agency nurses to get a registered nurse is $80 an hour. And then for our currently employed school nurses, there's a big range depending on where you are in your certification track and how long you've been with the city, certainly. So at the high end, our nurses are in about the mid 90,000 range per year, and at the lower end, they're more like the mid 50,000 range per year. And I can't say offhand what that is as an hourly rate.
Thank you.
Councilor Lopez, you all set?
Yes, thank you.
Any other questions? I see we've been joined by Councilor Raina Getz. Welcome, Councilor Getz.
Oh, there we are. Let's see if I can.
Questions or motions from the committee?
Yeah, no.
Motion to approve.
Councilor Oliver has moved approval of 192-24. Any discussion? All those in favor, please say aye. Aye. Any opposed? Any abstentions? That is 6-0. Thank you. Our last non-budgetary item, item 197-24. This is Her Honor, the Mayor requesting authorization to transfer $125,000 for Law Department legal services from one account to a full-time salaries account. I believe Ms. Giuliani is here to both speak to this item and then possibly the budget after this, but let me turn it over to you.
Thank you, Mr. Chair. Good evening, members of the committee. Yes, we are here asking for the committee to consider transferring $125,000 from our salary line to legal services. As many of you know, back at the end of 2022, we unfortunately lost a member of our legal staff, Jeffrey Honig, who was our master of all things labor relations. We have been on a hunt to find someone to replace him, but that is proving difficult because we are looking for someone with a significant amount of experience to take over a lot of the in-house bargaining and handling of a number of grievances and arbitrations. We have a staff member in the office who was actually brought in to work with Jeff. So Jennifer Kelly, is handling a number of the grievances and arbitrations, but we have had to turn to outside counsel to handle most of our labor bargaining with our unions. And so we're asking for this transfer to make sure that we can continue to engage them. They're doing an excellent job on behalf of the city. But I still am working to make sure we can bring a lot of that work back in-house.
Thank you. Questions from committee members or any councilors? Councilor Hauke.
What's the progress in finding a full-time replacement?
So we've actually posted the job and reposted in a number of locations, in legal periodicals, with our certain legal organizations, professional organizations with whom we're associated with, like Mass Municipal Lawyers Association. The City of Newton also posts publicly and Indeed. We've certainly gotten a response, but we haven't really gotten anybody with the type of experience that we're looking for. Someone to really lead this work, not just to do it. And so I think our networking has really been more effective. Unfortunately, we've been unable to secure the couple of folks that we were able to chat with through some of our networking. So we're continuing those efforts while continuing to post and repost, but there are not a lot of people who are either looking for legal work or looking for labor relations work. And a lot of my colleagues in other cities and towns have said they've found difficulty finding staff as well. But we're keeping it up. We're reaching out to our contacts and doing some networking. And I'm hopeful that we'll be able to get someone who's a really good representative for the city. It's just taking a little longer than I had hoped.
I guess so. How, I mean, how long are you prepared to sort of go in the current situation? Something else, I don't know what else you would try.
Yeah, I mean, I think that my preference is to bring this work in-house, but with the salary savings, we do have the funds that, of course, you know, assuming you would approve a request like this, we have the money to sustain having outside counsel do the work. And let me say that the lead attorney, Mike Macaro from Murphy Hesse, who's doing the work, is doing an excellent job working with us and with our unions to bargain matters that that need to be bargained, and he's doing quite a bit of work for us. So we can sustain this financially. It's just organizationally, my end goal is really to bring it all in-house and to replace Jeff as best I can.
Okay, thank you.
Sure.
Counselor Lebowitz.
So is the salary an issue in terms of hiring? You said you were interested in 2 candidates who didn't, presumably you extended an offer. Was it
Yeah.
salary an issue? I'm curious.
The salary, yes, salary is always an issue when looking to find experienced legal counsel. I am grateful to Maureen and the mayor who agreed to increase the salary for our second round of posting. I think that, you know, in talking to some candidly to one or more of the candidates, salary was definitely an issue. Benefits, just to give you an example, and a candidate we spoke to was really looking very closely at our health benefits and felt that what they had in another community was more superior. You know, vacation time is always something of interest for folks, and in other communities. In one other community, they were asking for more than we allowed in the city of Newton. So, but I think there are a number of benefits that are more attractive than some other communities. So at least in the experience I've had on this position, it's sort of a weighing factor for folks and considering what works best for their family. This second time around, with a higher salary, I really haven't gotten that many responses. I don't know that there are that many people looking for this particular work. So that's why we're trying to be a little bit more creative and reaching out to some of our colleagues in other communities and encouraging folks to consider Newton.
So the amount that you spend, or that you pay for outside counsel, is that, you know, compared to what's now being offered for a salary, is that equivalent? I mean, I'm just curious about that. Or are we spending more because it's outside counsel than we would have spent on an inside counsel?
We are not spending more on outside counsel than having someone inside. It is very comparable. The dollars we are spending on outside counsel, really give or take about $5,000 or so. We're not paying significantly more money for outside, and we wouldn't pay significantly more money if we brought it in-house. It's just about the same. It's really a matter of how we prefer to operate as a legal department.
Thank you.
Counselor Humphrey.
This is a direct follow-up question to that question, which is, with the outside counsel, are we giving less work to that person than we would if we were doing it in-house because we're trying to keep the cost at parity? And is that a factor in some of our ongoing, delays on bargaining or anything like that?
So no, as it so happens, just before Jeff's unfortunate passing, I hired another attorney. Jeff was doing all of the labor relations work in the office. And I was hiring someone to work under him to allow him to sort of decide where he was going to focus. And my understanding was he wanted to focus more on the bargaining and get someone to help with the grievances and arbitration. So luckily for us as a department, we brought that person on before his passing, and she has taken on all the grievances and arbitration. So we luck out there because that's not the kind of work that we need to engage outside counsel for, which would undoubtedly be much more expensive. So what we've done is we've had outside counsel focus mostly on bargaining with our unions, and I'm not holding back too much because I've got someone inside who's working on the day-to-day, the advising our department heads on other personnel matters, and reviewing other employee issues. So we're really keeping our costs relatively low under the circumstances for having outside counsel handling labor relations by just having them handle the bargaining. And we're not missing any deadlines. It's actually worked out really well because our outside counsel can focus on bargaining instead of having to turn their attention to day-to-day issues like discipline, employee policies, and other grievances and arbitrations.
Thank you.
Yeah.
See no other hands. There a motion? Council Maliki has moved approval of 197-24. Any discussion? All those in favor, please say aye.
Aye.
Any abstentions? All right, I believe that is 6-0. Thank you. We will now move into the budget portion of the evening, and I did just want to caution folks, we do have one item after the budget items. It was an individual, it's an appointment, but the individual I think was not able to be here earlier, so actually wanted to be at the end of the meeting, lest anyone think we intentionally pushed him off. So the first budget is the law department. City Solicitor Giuliani, I believe, will speak to us about that, and then we will get into our discussion.
Thank you again, Mr. Chair. I'm presenting to you our budget for this year in the amount of $2.25 million. It represents a minimal increase of 4% over last year. We're doing really well in terms of our budget. Just as I said a few minutes ago, this hopefully temporary change in our labor relations really hasn't made too much of a difference in our budget. I think we're managing it well financially. There are a few things I want to highlight that are just sort of changes in some of the work that we're doing. You will see in our financial and operating highlights a significant increase in what appears to be claims over the last couple of years, from FY22 to FY23. It appears we doubled our claims. This year we're on target to be just around that 300 or so or more claims number. We have a much more robust and comprehensive and organized claims intake process and database system. So we've just been tracking them a lot better than we were in prior years. So we really feel like the system we've got in place is tracking all of the claims that we receive. And just to give you an idea of what those include, I'd say about a third of our claims are those for street defects and those for water and sewer claims. The remainder are motor vehicle accidents, tree claims, small number of slip and fall claims, and also a small number of claims for damage as a result of snow plowing. But the lion's share of them are for street defects and water and sewer issues. So those are our claims. Like I said, we're tracking them a little bit better in how we manage them and maintain them in a database. So I just wanted to give a little context to the numbers that we've experienced over the last couple of years. Like I said before, we don't have really too many increases in our budget. I would say that our outside counsel line item for legal services, we've asked for an increase, as I said, to account for outside counsel. The biggest increases are in the areas of our line item is called printing, and it's really to account for deposition costs and transcripts. We're anticipating that we've got a big case that we will be handling this coming year, a wrongful death case against the city, as many of you are aware of. It is working its way through the legal system, but if the case continues beyond the motion to dismiss stage, we're anticipating that we will enter into discovery, and that we'll have a lot of depositions that we'll have to cover costs for. I wanted to be prepared for that. Also, the increase we see every year is for the cost of our next request system, which is our public records request system. We receive somewhere between, I want to say, somewhere between around 600 a year of public records requests. We're seeing an increase every year of these. I think we will continue to, as more people utilize this as a means of trying to find out more about our city operations and government actions. And every year that we increase our utilization of the next request system, which is the public records request system that the public can access, the cost of that goes up every year. But it's working really well. It allows us to communicate directly with individuals who request information and to communicate internally to departments to gather the information requested and to get it out within the time required by the law. So those are really the big increases. The one last change I'll say to our organization chart is for a number of years, we enjoyed the expertise and experience of Alan Mandel as our part-time legal counsel on telecommunications matters. Alan retired after many years in this line of work, and we made a decision to absorb his work. Andrew Lee has been working with him very closely for the last year and a half or so, anticipating Alan's transition after retirement. So Andrew has absorbed most of the work along with Andrew's team internally to support the city and the city council on all things telecom. So we have made a decision not to replace to fill that position. So you'll also see in our budget documents that there was a reduction of that part-time salary, and we're not backfilling that.
Thank you very much.
Yeah.
This is a quick question, and I understand if you're not able to answer it, but I'm hoping you can. In outcome 2, it mentioned about providing support and advice to the city clerk's office to prepare the ballot question for repeal of the winter parking ban for presentation to voters during the next local election. So what advice or assistance is expected there? I mean, I didn't realize there was, it makes it sound like it's going to be a complex thing. So I was just trying to gauge what was going on there.
Anytime, it's not complex, but as you know, with any any election or special question, there's always an added lift for the city clerk's office. And so we just anticipated, we have every reason to believe it will go smoothly, but we just anticipate that we want to be available to them to advise under the law what procedures need to be followed, and make sure that they've got everything they need to make sure that that goes smoothly. So nothing complicated in that sense, but just getting prepared to support the city clerk's office.
Okay, so yeah, so it sounds like it would just be regardless of what the topic was, that if you were having a referendum question, that you would be advising them on that. And
Correct.
just for my clarity, I think this was already addressed in another committee, but I wasn't there for that. This question is not gonna be this year, it's gonna be next year, is that correct? Because it says next local election, so I'm just clarifying, because I had also seen some document referring to it as the November election, so I assume that's for next year, but.
That's right. That's right. But there's just a lot of advanced planning to get ready for that November election.
Okay, thank you.
Counselor Lapidus?
Is there a charge for public records requests?
There is no charge for filing a public records request. However, under the law, if the request is significant and will require more than, say, 2 hours of work to respond, the municipalities are permitted to charge the requester for work within the guidelines provided by the law. So there is no charge for filing a request, but there could be a fee assessed to the requester if it's a very comprehensive and time-intensive response.
So how often does that happen where it takes more than 2 hours and we charge?
I can't give you a number, but it's a small percentage. Many of the requests that we receive can be answered very easily with city documents, and those are things that we can turn around very quickly. So it's a very small percentage that are cumbersome in nature that will require the city to expend a lot of time and work hours to put together. But generally speaking, most of the requests that we respond to are done very simply and without any cost to requesters.
One more question. This case that's the big case that you were referring to. Will that influence in any significant way? I'm assuming the city has insurance. Will that influence in any significant way the amount we have to spend on insurance?
So the city is self-insured. We do not have private insurance covering the city.
Okay. Thank you.
Counselor Malcolm?
On the legal claims settlements amount, both 2024 original and 2025 budget at $100,000 is way lower than historical recent years. Is there a reason for that?
Every year, counselors ask this question, and $100,000 is the amount that is set aside in the settlements account. We usually, it's almost always enough to cover the settlement of the types of our claims, the types of claims that I mentioned. In the event that the city has a large judgment or planning ahead for potential settlement of a much more significant case, then I have a conversation with our CFO to properly plan for that. But for the most part, that line item is there to cover our claims and small settlements, which generally do not exceed $100,000 a year.
Mr. Chair, if I could jump in. Is that
Yeah.
okay? Okay, thank you.
Ally really covered that quite well, the last question, which every year people do ask. It's a great question. As Ally mentioned, it really does, that amount covers the baseline. What every municipality in Massachusetts does is, has to do is use free cash when you have a larger judgment. So really that is what free cash, one of the uses of it is for settlements. And so we don't want to tie up in the budget of this department a large amount of money that may or may not get used each year. It's much better to budget for a baseline and then make sure when we are calculating our free cash needs for the coming year that we, you know, we make sure we reserve some money for potential settlements, which we do.
Okay, thank you. And going back to outcome two, the other thing in that I was curious about, besides what Councilor Humphrey asked about, working on an update to the schools department Title IX policy and ensuring compliance with new and upcoming regulations. So Title IX is, I think, the gender equity. What is changing there?
Correct. The federal government has updated its regulations with respect to reporting and investigations of Title IX. And it has really caused a number of school districts to have to change their approach of investigation, response, and remedial action. So we're lending as much support as we can along with to the school department along with their general counsel to make sure that their policies are now in line with the new regulations, to make sure that their practices are, and to make sure that we're following the law with respect to investigating Title IX complaints and responding with remedial action where we need to.
Do we have many complaints?
We thankfully do not have a lot of these complaints through the school department, but it's not unusual for us to get one or two every year and a half or so. And so we just want to be prepared. And the new regulations are a bit, they're a change in past practice for school districts and a bit more cumbersome. So we just want to make sure that the school department has all the support that they need to make sure they're doing it right.
Okay, thank you.
You all set, Council?
Yeah, I think so.
Well, thank you. I'm glad you asked about that because I was going to ask about the Title IX as well. So just sort of in follow up to that, I wasn't aware that there had been a regulatory change with regard to that. Is there any correlation between enhanced public records requests and the Title IX regulations?
Not that we're seeing in my office. We haven't seen any uptick on that topic.
Okay, thank you. Councilor Oliver?
Great, thank you, Chair. I'm just curious, when we see the personnel count that's showing here 14 full-time staff, I'm assuming that you're still including or protecting the open role we just discussed, right?
Yes, yes.
Yeah, so that's in here. So then when you look at the line item that is, what's it called? Legal services 530,900, right? If I understand that correctly, it's going up from $50,000 in 2024 to 2025 at 100,000. And my apologies if this were one of the line items you talked about briefly, but is that in part outsourcing of additional legal services on top of then the outsourcing of the vacant role?
Not really. That is to cover a number of legal expenses we are anticipating for a wrongful death case that is coming up. We have We do have outside counsel handling that as well. We want to be able to be prepared for managing that litigation this coming year as well.
Great, thank you. That makes total sense. And then my last question is, and I've been kind of asking this of all the departments. If there were one extra dollar of budget available to your department, or one extra project, or one extra something, where would you spend it?
If I could have one extra thing,
One extra thing, yes.
I would have one extra attorney,
One more human.
one more human.
Great. I love the solid answer. It's great. Thank you.
Not just any human, John, an attorney.
Oh,
Preferably.
good distinction. Thank you, Counselor.
And I just want to
Absolutely.
clarify, are we budgeting for one more vacancy or are we actually bringing another human in?
I will clarify, if I could have one more thing, it would be one more attorney,
There we go. So
Yeah.
no human attorney. Got it.
not just any human.
Right, got it. Not to imply that attorneys and humans are just, no, okay, I won't go there. All right.
I think we all know that attorneys are better human beings. Councilor Labovitz.
I have one other question. What is the role of AI in the legal department at this point? Are you looking at that? Are you using it? Can it in fact replace a human?
An attorney.
A human attorney?
So, we are not using AI. It is an interesting thing. I do not believe it replaces an attorney. That's my opinion. And on that particular topic, I am waiting to see how things sort of shake out in the legal community. Just a few months ago, there was an unfortunate case for an attorney who used AI to draft motions, and it did not go well for him. And he was sanctioned by a judge. I'd like to wait and see before we start testing it out. So we're not using any AI, just following along with the stories on it.
Thank you.
Is that the footnote to the case that didn't exist? Is that the one we're talking
Yeah.
about? Yeah,
That's right.
Increasingly sort of self-referential to other AI content, which is not very successful.
Okay, I'm not seeing any other hands. If someone wanted to make a motion, I believe the request, okay, Councilor Humphries moved.
Bravo.
Sorry for the straw vote. I apologize for my wording. It would be a straw vote for approval of the budget, which I believe is $2,254,762.
She dropped off. So yes, according to our budget, but that's.
Okay. Anyone want to discuss that before we take the straw vote? Okay, all those in favor, please say aye.
Aye.
Aye. Any opposed? Any abstentions? 6-0. Okay, thank you. Councilor Giuliani, appreciate it.
Thank you. Good night.
Next up is Veteran Services. Seth Byer. Welcome back, sir. Good to see you again.
Good evening, everyone. Great to see you all.
Good to see you. Do you want to talk a little bit about the budget request, or do you want us to just discuss it?
Let's see. Connor, do we want to share a screen? I don't know if they, because not much really changes in my budget year to year. I can just identify that it's $10,000 in advance this year than last year, and that goes off of the great thought-provoking questions that both Perry and Connor asked me with regards to how Maureen Lemieux forecasts my budget when it comes to reimbursements. Outside of that, my budget is pretty much copy and paste from last year.
Fair enough, and accurate as well. Appreciate it. Any committee members want to ask any questions, especially those of you who may not have been here for the Veteran Services budget in the past? Counselor Oliver?
Yep, thank you, sir. So I don't necessarily have questions about the budget per se. I simply want to say thank you for everything you do for this city, for the veterans that live here. I think your services are fantastically appreciated by everyone, veterans and non-veterans alike. And from that perspective, I really don't have questions. I think this is very, you know, well described and as we've heard, fairly consistent budget across the years.
Counselor Humphrey?
Yeah, I had a bit of a more general question. Do you know in other communities that have smaller governments, and smaller populations, how do they handle some of the responsibilities that you have to handle? Because I'm imagining that there's some communities where they probably can't afford to have someone like you doing this. So do you know from working with some of these other municipalities, how they handle it when they're too small to have something?
Yes, I believe I know the answer to this. We'll take the Berkshires, for example, out there. There's a director of veteran services, much like myself. Actually, it's a female. She was in the Army, and she manages, or should I say, she splits up her time between 5 smaller communities. So, just give or take, Monday, Tuesdays, she's in Belchertown. Wednesday, she's in Northampton. Does that make sense?
Yeah, well, because I was curious, because I know in years past, you've talked about sort of the ebb and flow of the level of services needed depending on where people are at in their retirement cycles, or unfortunately, if they've passed on. And so I'm always just curious as to what happens if we were to get to a point where there weren't that many people that needed the services, or maybe there was a ton of people that needed the services. So I'm just trying to get a sense of kind of where we land comparatively. So I appreciate the answer on that.
I understand your question. It's very thought provoking, and it's thinking forward. I talk to Jonathan Yo weekly, and I share with him my interesting cases that come in, because as you can imagine, the greatest generation is doing the biggest exit stage left right now. They're all leaving. So I'm meeting a lot of baby boomers of sons and daughters of World War II veterans and or widows, and they're coming in looking for the final wrap up of services for their mom or their dad. So as it's a somber occasion because they're all checking out. At the same time, I'm getting to do outreach, and I'm meeting a lot of baby boomers in the city, a lot of residents that are now interfacing with me because they themselves are not necessarily veterans, but they're interfacing with me, coming into City Hall. And then now they're plugging into more of the outside programs that we're doing, 9/11 ceremony, Veterans Day, and whatnot, getting them plugged in with the new Cal building and how that's coming along.
All right, thank you for sharing that. That's helpful to know.
Counselor Albright?
Thank you, Mr. Chair. I have a question for you about the chart that's in the budget. I just need to help understanding it. There's a vets receiving benefits chart.
Yep, I need to change my screen, but I understand what you're asking me.
Okay,
So what's your question?
so there's VA federal benefits and mass benefits, and then active appeal. Can you just explain that a little bit more? The numbers don't add up, so it must mean that some of these benefits are not active or not an appeal. I just don't understand.
Correct. All applications are active, but being active and being appeal are 2 different categories, in the sense that appeal means you were denied something or they need more bona fide paperwork. So I'm going through case management at that point. And then active means that they're still awaiting potentially more accreditations or doctor's visits or diagnoses at that point. When you look on the mass side of the house, the Massachusetts benefit is always going to be lower because the threshold for the federal poverty level is so low that it doesn't really pertain to the residents that I'm interfacing with on the regular in the city. I've got several cases, obviously, in Newton Housing, so that's where you would find those cases. But at this point, a lot, I mean, when I put those cases in there and I put those numbers in there, I mean, just a simple federal case would just be getting a burial reimbursement from the VA because you're putting dad or mom away, paying the cemetery fees. So those are all rolled into my numbers. Not everything is an Agent Orange claim. Not everything is a PTSD claim. So sometimes it's burial benefits as well.
So, okay. So for those involved with federal benefits, there's about 100, maybe a little bit more people. Does that
Yes.
sound about right?
That sounds about right. Yes.
And some of those 100 people are in the active appeal category?
Correct.
Or-
They're active, and an appeal means there was a bump in the road. They need more doctor's notes. They need more documentation. So it's I guess you'd use that expression. It's a second bite at the apple, if that makes sense.
Okay, so, do we only have 100 people in Newton that are accessing VA federal benefits? Is that
At
right?
the moment, correct. Yes.
So does that mean that we only have 100 people in Newton that are eligible for veterans benefits?
No, that's not necessarily what it means. I don't know exactly the question you're trying to arrive at, but if you'd like to, like, historical data would show that 10% of your population is typically veterans and or dependents. So if you want to use a round number of 90,000 residents in Newton, then you would say that there's 9,000 veterans and or dependents out there in the city. Depending on where they are in the strata of all the different generations. For example, I'm not 50 years old yet, but I'm still in my working years. So some veterans are just coming in just to get their hearing aids, and they're back out the door. And I won't see them again until they're 65, and they're looking at picking up VA healthcare. So some of my clients are one and done, if you will, or I'll see you down the road. And some of them, I do a lot of hospice claims.
Do you
And those
think
take up the, go ahead.
I was just wondering, do you think that the 90,000, let's say, residents of Newton are aware of the services that they could be getting through veteran services?
Yes, I do. I use the Twitter account. Maybe that doesn't exactly reach the Korean and or World War II veterans generations, but between social media, the city webpage, I was just at New TV today doing my public service announcement there. So I'm putting my face out there. I'm putting out my message.
So one suggestion that I might make is that for those people that don't watch New TV or do Twitter and things like that, maybe every now and again, you could ask the mayor to put something in her newsletter about veterans benefits and that they could come and see you.
I'll be happy to do that. I'll work with Ellen on that. As with that newsletter, we could do that quarterly if
Yeah.
that sounds amenable to you.
I think that would be useful. Thank you for that.
Absolutely, no problem. Thank you for the insight.
Yeah, we have done some of that in the past, and certainly with Cooper Center opening up, it provides a new, we think will be a pretty nice opportunity for Seth to reach additional people. So we will be taking advantage of that as well.
Good, thank you.
Thank you.
All right, thank you.
Councilor Migley.
Yeah, thanks. Thanks Seth for being here. Don't want to take up too much of your time. I see your shirt and I know we have an exciting Bruins Panthers game on right now. Still 0-0, but after a 5-1 win the other night, optimistic we can take the Panthers out, as I'm sure you are too.
Yes.
So I guess first, thank you for all that you do, very important work. Just to expand on what Councilor Albright was mentioning, also would want to offer the city council as a resource to make sure that we can be helpful in making veterans aware of the services available. So if there's something that you want to, share with the city council, We have various ways to communicate with the public, either as an institution or as individual counselors through our own newsletters. We'd love to help distribute that to more people so they can take advantage of the services. And the question is really, is there anything that you think veterans would benefit from in terms of engagement with city events, community events, things that we can be helpful with beyond just the, management and distribution of services?
I didn't know if Jonathan Yo was asking a question or if there was a goal in the background. I didn't.
There was a goal. I might be ahead of you. Sorry.
Okay. Sorry about that. Yes, Councilman, I'll be walking into the clerk's office next week, wrapping up all my touch points for the upcoming Memorial Day events. So I will use my work colleague there, and I would like to get some sort of regularity of making sure that if there's an area in town, in the city that they'd like to do like a coffee hour or whatever, I go hang out with that particular council person in that section, and then we could do some engagement there. I would like to do that.
Okay, great. I'd be glad to be involved with that. So feel free to be in touch with city
All right.
council as individuals. Yeah, great.
Yep, I'll be in touch with you very soon.
Awesome. Thank you.
Thank you.
I'm not seeing any other comments. So the straw vote would be for the amount of $210,729. Humphrey has moved approval. Any discussion? All those in favor?
Aye.
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 Any opposed? Any abstentions? 6-0. Thank you. Thank you, Mr. Bai. Enjoy the game.
Thank you, everyone, and I'll be seeing you in the next couple of weeks with these festivities coming up. Thank you.
Next up, we have the Health and Human Services Department. Looking at my handy dandy notes from Ms. Norton, looks like Commissioner Walsh is here, Jenna Bancroft, the Director of Social Services, Ruth Ashino, the Director of School Health Services, and Shinyi Lau, the Public Health Manager. I see you all there. Welcome. Commissioner Walsh, are you heading up the chart here?
Yes, I am.
Please proceed.
Thank you so much. Yeah, I am here with my colleagues. Thank you very much for introducing them. People who know me know that I love org charts. So when I look at our budget tonight, I always start with the org chart. And I asked my three colleagues to come with me because they are the directors of our three biggest divisions. We have a large, robust, multidisciplinary team in Health and Human Services. We are fortunate, really, to have the school nurses work for HHS, a great staff of social services people to work with HHS, and of course, the bread and butter of every health department. Shinyi oversees the public health nurse, the environmental health inspectors. So much work gets done, and just is it amazing. So I am so proud to lead this team. I brought them along in case I need some content expertise for any of your questions. And on my org chart, I don't want to forget the administrative assistant that we have. Many of you know Sherry. We have two tremendous, wonderful people who work at our front window. They are the gatekeeper and they're extraordinary. So I just need to sing the praises of this department. It is a joy and a pleasure to work here. Then in the budget, you'll see some in the featured highlights, you'll just get a sense of the numbers for school health and the number of kids that come through the health room and the reasons that they come through. 93,000 visits this past year, social services, how many people they reach out to that they help connect to services. And then we always like to explain how many permits and licenses we have, because it's a big number, almost, 473 food establishments. It's a lot of places to get out and make sure that they are doing the right thing every single day here in the city. So that's how I would begin from this high level. Ruth has been our Director of School Health Services for a number of years. Shinyi has been here maybe 8. Jenna is brand new to the role. So many of you remember Megan Kennedy. She moved on to a new opportunity. We're so lucky that Jenna Bancroft was her assistant director of social services, was promoted. So this is her first budget meeting. So now you will get to know Jenna. So I'm happy to take any of your questions. I'm sure you have a bunch because we have a bunch going on in our department. So happy to answer them if I can and use my colleagues if you need more specifics.
Great, thank you very much, Councilor Lebovitz.
What are your biggest challenges right now?
What are our biggest challenges? Well, if I think about the three divisions, I'll just quickly say, in the school health division, it's staffing. We started that way. We started talking about the number of school nurse openings that we've had all year. Ruth Oshino and her assistant director have done countless interviews. We do get some traction, especially at the beginning of the year, you know, when people are looking to change jobs, to change schools, to come into school nursing. And we have hired some people because we have normal attrition. We have retirements, we have people moving, we have people leaving. But I think Ruth would join me in the opinion that this is unprecedented. We've both been working together for many, many years. And there was one year we had a lot of school openings, 7. I remember that because I was doing the job right before Ruth came on, and that was a lot. But that was a long time ago, and we have been able to keep up. In the last year and a half, we have really had a hard time recruiting and retaining nurses. So I would say in that division, that's the challenge. In the environmental health division, we had a big turnover of staff there too. We had a big sea change. All 4 of our environmental health people have been here a short period of time. I think our most senior now, maybe a year and a half, Shinyi. He's fabulous.
2 years.
Oh, 2 years? Oh, look at that. Time flies. He's great, but he's new-ish. And then we have 3 more people, and 2 of them are really, really new. So Shinyi has spent a lot of time and energy onboarding these terrific people. But it's a young division right now. So lots of trainings, lots of competencies, lots of working with them along with some of the state programs that they go to, the other programs, but that's a challenge. We're fully staffed, so I'm happy to say that, but new people that have a lot to learn, and that's a challenge. And I think in social services, well, the world is a difficult place. Social services has had a lot of stress put on them from a really difficult year where we lost people to homicides and murders. And I can't even believe that that happened, right? Right after COVID, where we were really trying to help people in the middle of an opioid crisis and a substance use and abuse issues just across the nation. We suffered some real terrible losses in our community. So social services has been super, super busy responding in a way that really supports our residents. And on top of that, we are going to have a really challenging summer because the people that we have in the division are terrific, and 2 of them are having babies. They did not coordinate with each other. They promised me they didn't do that. They're going out at the same time, pretty much. So we will have a summer where we have, you know, we're welcoming some new staff people's children, but they will be off for a period of time. So Jenna is going to be off for a little bit starting soon-ish. And Mary Haas, who I hope you all get to meet. She's our new young and youth and young adult services person. She's going to be out around July until the fall. So, and we're looking for a new assistant director since Jenna was promoted. So I think the challenge there is staffing too, right? Getting the team together, getting everybody up to speed, getting everybody back after they take their much deserved leave. So we'll be in great shape in the fall, but it's going to be a challenging summer. We have contingency plans. We have folks who are cross-training now. So we will do the best we can.
You failed to mention one important departure.
There, coming departure, isn't there, from the?
Yeah,
department?
come on, you,
I left that out. I just,
yeah, I will say for all of us,
On a
it will be a big transition.
I was referring, thank you for all that explanation, but I was referring more to challenges in the public health realm, not within the community, not so much the staffing issues. But what are the major public health challenges right now that are not only and foreseeable that are going to become even bigger, perhaps?
it's an excellent question. You know, there's lots of things that are challenging in the public health world: emerging infectious disease, climate change, social norms of behavior. So those are the big picture issues, but I'm sort of a locally focused gal. So I answered you by division to say that all of those big issues in public health affect all of us in these ways as we do our work every day. But I would say those are the top three. We always have to be prepared for emerging infectious disease. Everybody thinks COVID was really the thing that put public health on the map, but before that it was MERS and SARS, and it's H1N1, and it was Ebola, if people remember. I've lived through, in my tenure here, lots of emerging infectious diseases. So that's still going to happen. We have to be ready for the next one. We've got our eye on the bird flu, and that affects the general population. It affects people's health and well-being. It puts us right at the forefront and working with the state to see how we get whatever therapies to our city. Emergency preparedness is always on our mind, always, because what's likely to happen? Hurricanes in New England. So I could go on, but that's where I'll stop.
Thank you.
Councilor Albright?
Thank you, Mr. Chair. So one question has to do with the project that I would love to know more about how it's going, that's serving the lowest income folks to help them get jobs and give them job training one-on-one. Are you interfacing with that program? And when that program phases itself out, do you think HHS will be able to pick up the slack and help these people move along?
You're talking about Newton Thrive, which is a program run by Empath,
Yes.
terrific organization. Thank you for asking about it. It is getting started. We're in our first year. We have, they have chosen the 50 folks that they are working with. They're all paired with mentored. It's off to a great start. We have a monthly meeting. So yes, intimately involved with the work that they are doing. And then we talk weekly. Two of the mentors actually we see every Tuesday because they do see people in City Hall, not only in City Hall. They will meet people wherever they're comfortable, but we have integrated the people that are working in the Newton Thrive program right with us so that they have the support of Jenna and her staff as they move along, helping these folks meet their goals and achieve their goals. No, HHS will not be picking up the program and carrying it forward. Empath is looking at doing that. Part of choosing them was to make sure that at the beginning, they planned for the end. So we are not planning on that. They are planning on that. With these 50 folks, we are hoping everybody does well. That would be unrealistic. I'm sure there will be a percentage of people through whatever reasons don't hit the mark. But they have other programs. And that's why I thought it was so wonderful that we chose some program like Empath. So the people that are successful in our program can matriculate into their longer programs. The people that don't, hopefully we can connect them with a different program. And hopefully, and not hopefully, definitely, we will continue to work with them as Newton residents with our own staff. So excellent question. it's coming along, just really getting started.
Okay, well, thank you for that. And just one thing, maybe this is more for Mr. Yo than anybody else. I'm hearing, HHS has staff turnover and hiring new people. And I think the law department is having trouble hiring some people. And DPW has 27 vacancies. And this was all brought to mind today because our clerk just told me that they offered our vacant clerk, council clerk position to two people, and they both turned it down because the salary was too low. So I'm just, this is not for HHS. This is about across the board in the Newton City government. Are we paying the salaries that retains the best and brings in the best?
That's
And I'm worried about it when I hear all of this happening.
Yeah, thank you for the question. Fortunately, in DPW, we've cut our vacancies in half. I mean, we're in much better position than we were recently. Municipal service is something that, ebbs and flows in terms of demand. And, right now, it really depends on the position. We have some departments that are fully staffed, and we do pretty well in getting good candidates and enticing them into city of Newton service. I think law department, we're really down to one. That position is such a niche position for filling the negotiation attorney position. So, and some of these, are you paying enough? There's a domino effect to trying to raise salaries. Then you're going to have to raise everybody else's salaries all the way up to the top and across the board. So it's something that HR is certainly looking at and talking with the mayor's office about. At some point, municipalities on occasion do classification and salary surveys, and we are looking carefully at how our salaries compare to other communities. We've been bargaining and looking at our school nurse salaries. So we've certainly been looking at what other communities are paying. So we are very cognizant of where we are in terms of salaries and benefits. And that is something that HR works closely with the departments on, and then with the executive office. So it's a good question, though.
Thank you, and I look forward to hearing more about that as we go through the next year. Thanks.
Councilor Malachi?
Yeah, so I've got a bunch of questions. This is my first time on this, maybe going through this budget, I think. Some of the big items, and I don't know how much of them are maybe reallocations or recategorizing things. Under the mental health services, there's a huge jump in counseling services, which I think is a good thing, given the number of mental health issues around. But how is that? What's the reason for that? And is that I guess a contracted service, since it doesn't appear to be salaries?
Are you referring to the difference of the 125,000?
Right.
That's a service we've always had in Newton, but needed to pick up the full cost for. It's called the William James Interface program, where you can call them, anybody can, of all ages, to match with a mental health provider. In the past, it had been paid some with the schools, some with HHS, and then I believe, Jonathan, did we use HCA money for a little while, which we no longer have anymore? So gratefully, we were able to fund that fully. We would not want to lose that service. Jenna will be in receipt of those quarterly reports. They do a tremendous job. They give us data of how many people they help, the reasons why they called. It gives us a really good window into the world of what people are dealing with. And honestly, a lot of our parents and caregivers and guardians in the schools use it, because when you're dealing with an issue, you're so overwhelmed. And if anybody has tried to match with a mental health provider, it is cumbersome. Who takes your insurance? Who has an opening? Who has a remote? Interface does all of that for you. So that's the 125.
Yep, following up on that quickly, the changes in the state regulation on the marijuana HCA agreements, sudden change, really has had an impact in terms of, reallocating programs within the budget, because we suddenly had to then take on either in the school department or in HHS to take on those programs. And the police dog had to be paid for. Leo has to be now paid for by the police department. So there were a bunch of changes, Counselor Maliki, that were related to the HCA loss of revenue.
And maybe separately, could you give kind of a recap of what happened there and the fallout from it? Was that basically the host community money just went away? It was that running out?
Yes, the Cannabis Control Commission at the state level, which has a lot of power, frankly, was sort of captured by the marijuana lobby and their attorneys, and they wrote regulations that were strongly opposed by the Massachusetts Municipal Association and communities, including Newton. But all of our comments were ignored. They've put into effect these regulations, which are going to make it extremely difficult for any community to obtain HCA funds. So we can't bank on it any longer. So that's why we made this change and then started to find ways to fund the ongoing programs that we thought were necessary, things that we had started with HCA funds. And we wanted to keep going. Like this is a good example of one.
Okay, yeah, that explains the HCA item elsewhere. And is that also related under, okay, this is under HCA awareness, where you had emergency counseling and NPS services counseling that were sizable item in this current fiscal year and then just go away? Is that the same?
Yes, a lot of these things actually did not disappear. They just disappeared from this part of the budget. So we ended up providing schools extra money to cover a couple of the positions. I think they were school psychologists and something else.
This would show up in the NPS budget.
Yes, this is in NPS, or it's in other lines here in HHS, or it's over in the police department. I don't know, Perry, Connor, are there any other departments?
No, I don't believe so, but also on the special funds tab of the budget book, it does give a narrative regarding the
Thank
HCA
you.
contribution also.
Yes, we do describe this in greater detail in that tab.
Okay, great. And I was also curious about, this might be easy, medical vaccines going from 50,000 to 75,000. What are we going to be doing more of, or do we have to pay more to get the vaccines that we didn't have to pay?
Well, one of the big drivers of that is that COVID vaccine was free during all of the COVID pandemic. Now we need to purchase it, and it's expensive. Also, we do like to have a robust number so we can provide shingles vaccine, for instance, to our retirees, and provide flu vaccine, and provide the high dose vaccine. So I really rely on Shinyi and our public health nurse, Lisa, to look at the data, see how many people might take us up on the offer, asked for increased allocations so we could be ready to purchase COVID vaccine. That's the biggest differential there. So we'll be able to offer it.
Okay, and also I was curious about the, there's in the, I think it was the outcomes, somewhere, working with Metro Public Health Collaborative, Brookline, Bowman, Arlington, to do a shared infrastructure. What does that consist of? And is that a sort of a brand new thing this year, or has that been underway already?
It is sort of a brand new thing. We wrote for a grant with these 3 other communities and received that grant. So now we are working really closely together. It's a wonderful collegial collaborative to forward some initiatives. Really, the money comes to make sure that everybody is doing the actual work that each local health department needs to do in a standardized way. So it is new. We meet monthly as a group, and we've just started some initiatives that we'll do as a region. I think all of us can recognize that when your neighbor does something vastly different than what we're doing, it just confuses the public. So it's wonderful to be able to talk to Brookline and what do their inspections look like, and what are some of their programs that they're putting out. It just amplifies the message to our 4 communities. So it is new and it's exciting. And I'm happy to share more information about that with the council in the coming weeks so that you'll get to know more. We have a webpage that is, you link off of our webpage. So it's a great initiative. We work with the other 3 directors and staff, and it's just beginning to show some real promise in working together and amplifying the message and doing things in a standardized way. And we're able to get extra help too. So we 2 days a week have a shared person with Brookline that comes in, helps in our environmental health division. So it's all good things from the Metro Public Health Collaborative.
Great, thank you.
Is it 10 years, Shanae? It's a long time that we've signed up.
The intent of the grant is for it to be 10 years. And we're about a year and a half in.
You all set, Counselor?
Yep, thank you.
I'm not seeing any other hands. Oh, sorry, Counselor Oliver?
Yep. My number one question, or the one I keep going back to, right? The $1 extra, one extra project. Maybe it's 3, given the 3 divisions within HHS, I'm not sure, but what's the next need?
It's got to be staffing. It's got to be kind of in line with what Ally said. I need a really good nurse. I need a really good social services person. Yeah, it's about human capital here, finding really good people, not only attracting those people, and Newton is an attractive place to work, but then retaining them. And we've had a history of being able to retain people for long periods of time. And it seems like the restart button has started. So as people leave after years of service, environmental health is a great example of that. We had long-standing people, 20 years, 17 years, 15 years. And so we're restarting, and we hope that these people that are here 2 years and 1 year are here in 10. So I think that would be my wish too, is for really great people to join this really great department.
Great, thank you very much. That's all I had, Chair.
Okay. Not seeing any other hands. Is someone interested? Counselor Oliver has moved for approval through a straw vote of the budget of $5,161,765. Any discussion? All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? 0. Thank you. Commissioner Walsh, I guess that's the last one, huh?
Yes, the end. Fade to black. It's been a pleasure. I'll be here through June, so you know my number.
Thank you very much. Sincerely, thank you for all your service to the city, for the people of the city.
Thank you.
Took us through some very tough times, so we really appreciate your dedication, and so thank you. We'll just. The last budget we have this evening is senior services. Mignon Murray. We have it, but did you want to speak to us about that?
Sure. Good evening, everyone. So senior services, we provide programs and services for the over 22,000 older adults in the city who are over the age of 60. We do this in collaboration with many, many other city departments, including Linda and HHS, Recreation, Parks and Culture, Public Buildings, Assessing, the Planning Department, among many others that allow us to push our reach well beyond what we could do ourselves. FY '25 is going to be a year for the Cooper Center and the Department of Senior Services to kind of broaden and strengthen our foundations. If you've been by 345 Walnut lately in Newtonville, you've seen that the foundations are being laid for the Cooper Center. And we're doing the same thing in the department now and in the coming year. We want to, create the right staffing plan, the right programs, and get the right information from residents so that we can have the best possible building when we open for everyone. It'll be a hub for senior services and older adults, but it will be a resource that is there for the whole community and an inviting place for everyone. So the change that you see most on our budget resulting is that there is a position for Assistant Director of Programs and Services. That's the position we're looking to add in and hire this FY '25. And then there's also a wage reserve that is for possible needs that we'll have when we're when the Cooper Center will actually open its doors. We're slated for the fall of '25, but obviously Josh and his team at Public Buildings keeps a tight ship, and who knows if that will happen earlier than we think. But I wanted to mention a few of the other things that you saw in the report that says what we're doing to prepare for the Cooper Center. We're doing a needs assessment. We're about halfway through that process. We've involved UMass Boston to do that for us. They've done one-on-one interviews with key city leaders, including the fire chief, the HHS commissioner, the rec director, myself, and others. We did a survey that was sent out on paper copies to 5,000 residents who are age 60 and older. We also had an electronic version of that available, and we received over 2,800 surveys back. And the data from that is being calculated. We've done some focus groups and are doing more, including a community stakeholder group, which included agencies such as Newton Housing, Springwell, Newton Wellesley Hospital, the YMCA. We're doing other focus groups on solo agers, people who may be aging without children or without partners in their life, semi-retired residents who may have gone to a new career after their initial career or may have scaled down and are working part-time, a Chinese-speaking group, and a Russian-speaking resident group as well. So we are looking forward to having that data and that report pulled together in the fall by UMass Boston. They'll do public presentations about the findings, and it will give us and other departments and other organizations in town a really good new look at what the current status of older adults' needs, of what they have and what they think they'll have in the future. And we did a similar study with the same group 10 years ago. So our board chair of the COA is very anxious to see what the differences are. What do we see in trends that were 10 years ago, and what are they now? And in terms of trends as well, we had last year purchased My Senior Center software, which is the primary software system that most senior centers use in Massachusetts. They're also in 48 states, so it's a good standard. And the staff has worked the beginning of this budget year putting in information so that we're going to have, year-on-year information that we can track what the ages are of people that we're helping, what are the, what parts of the city people are participating from, so that we can tailor future programs and services to reach, more people beyond what we already are helping. You're also going to see us work on reframing aging. Reframing aging is a movement that came out of the Frameworks Institute, which was a lot of nationwide aging service organizations put together. And it's been proven, you've probably seen the news over the years, that people who have a positive outlook on aging actually live 7.5 years longer than those who have a negative impact, thoughts of aging. So that's part of what we do, is we want everyone, whether they consider themselves a senior, an older adult or not, to have a positive look of aging, because we're all going to do it if we're lucky. But you'll see, changes coming from that, such as the mayor, naming the building the Cooper Center for Active Living. So the Newton Senior Center is now the Cooper Center for Active Living. You'll see other changes coming in our communications, where we'll change words that are such as elder and senior citizen more toward older adults or residents, and we'll reframe in that framework to try to be as welcoming and accepting. And the way you phrase these things, it helps people connect with you in a better way. And it's an impressive work that the studies have been done. And the last thing I wanted to touch upon was transportation. Transportation, this was the fiscal year currently that our transportation service goes out to bid. So we have done that process and we're working very closely with the planning department to shore up that and get the details ready. They're not quite ready to talk about today, but in the coming weeks, I believe we'll have more information for the city on what that's going to look like. And I just wanted to say that my staff is amazing and do the work each of 5 people. And I'm very fortunate to have them and to work with them. And I'm happy to answer any of your questions.
Fabulous. Thank you very much. Appreciate it. Counselor Oliver.
Great, thank you, Chair. Just a couple quick questions. First one, I guess, is just a confirmation, right? Assuming that fall 25 remains the opening date, and I have every confidence that it will, I'm assuming that the work that you're talking about in several of your outcomes, right, in terms of leading to a staffing plan and, you know, assessing needs and so on and so forth, staffing levels are probably going to go up fairly significantly for the FY26 budget.
So we've been working on it already, you know, in close cooperation with everyone at the mayor's office and myself. We've been coming up with some different plans of what I think that's going to look like and what I think we'll need. You know, of course, it will shift and change throughout the year, but that first step is this current year we had a volunteer coordinator who was part-time, who's paid out of our formula grant. We've made that a full-time program coordinator position. So we're now going to have 2 program coordinators on staff. So that hiring process is actually going on now. And that's a formula grant funded position, not out of the municipal budget. And then this coming year with the assistant director position. And then we have mapped out what I think we'll need at this point going into the center. But we'll be evaluating that as we get closer with services and programs we're going to offer through the year to see what that'll exactly look like.
Yeah, if I could jump in on that, Counselor, it's a great question. We will need more resources. We know that it's going to be a bigger building with a lot of demand, we think, and we are hoping to expand services certainly. So Senior Services Department will certainly play a big role in that. Parks and Rec also, especially on weekends and evenings when there isn't as much older adult activity going on. Then they will also be pitching in with their staff. And then we'll also have volunteers, but we'll also have vendors who are providing programs in spaces, different spaces in the building. So it'll be a combination of people running various programs in the building. So it's something Mayor Fuller has been very determined to make sure that Mignon and the rest of the team come up with the plans now. And we're working really hard right now on outlining exactly the positions needed this year and then the year after. So good question.
Thank you. And then prior to the results of the tabs on the needs assessment being published, my favorite question, what's the one thing you know of, and I'll add right now, that you would spend an extra dollar or an extra project or an extra whatever? What would that be right now? What do you need between now and that needs assessment telling you need it?
Sure. You know, I think one thing that is always needed, and we're so lucky to have partners with HHS, is social services. You know, we have one case manager who works amazingly and does great work, but there's you know, there's a lot of people who have a lot of need, and you know, we're collaborating and working with HHS too to see how we can serve people better and make sure we're getting them as the max services that we can. But I would always take an extra dollar in that category.
Awesome. I do appreciate it. Thank you, Chair. That's all I got.
Here, Councilor Mickley.
Yeah, thank you. So you might have touched a little bit on it in your sort of overview at the beginning, but just want to understand about the NUMO budget. Is that transportation services?
Yes, so the NUMO budget is, I believe, the exact same as it was last year. And then there are grant funds that help fund transportation as well.
Okay, is Numo broken out into a different line item? So transportation services is $275,000. Is that all going to Numo or?
That all
part of
goes to NUMO, yes.
That goes to Numo, got it. So, obviously Numo does great work, you know, just 12,500 rides. Just came up in office hours earlier this week where someone talked about how much they appreciate Numo and, really, you know, does amazing things for so many in our community that need it. The person was under the impression that Numo was experiencing cuts, either wage cuts or service cuts. Have there been any cuts to Numo over the past year? Just given that there is a consistent line, I'm just wondering where that feedback came from.
Sure. The program changed back in September. We did change the demographics of people who were being served by the program. It was open to a larger audience. We dialed it down to a senior plus service, if you will, that was for budgetary reasons. Transportation, unfortunately, is hugely important and hugely expensive, and we want to maximize all that we can. And of course, getting older adults in the city to places that they need to go for doctor's appointments, but also places they want to go is a huge priority for me. But the changes someone might experience with Numo is that it is based on how many drivers are on the road. So we have a certain amount of hours. They put drivers on the road those hours. Sometimes a vehicle goes out of service for a day, it pops a tire, or a driver calls in sick and doesn't come in, or for some reason, there's a couple of hours a day that may have less drivers than another time. And in those times, it can seem like the system itself is cut, and drivers and/or residents can get frustrated at that. And there are some days that there are not enough, and we wish that there were more and that we could provide more. But on occasion, there are things that happen that there's a longer wait that is just for reasons beyond our control, even from a budgetary standpoint.
Okay, that helps. And I guess if the number is consistent year over year, it might actually lead to also decrease in relative service because of the cost of transportation and wages going up. Is that also fair to expect?
Jonathan, I don't know if you want to comment on, you have a longer history with that budget
Right.
than I do.
The biggest changing factor really is grants. So we were able for a number of years when we started the program, and then for the next several years, to obtain large amounts of state grants. And so we've been able to shuttle many, many people around the city for a number of years now. And a lot of those state grants have started to dry up, and that's what led to the contraction in the fall and into the winter. And so, we're trying to figure out what can we reliably count upon for this coming contract. So that will be a factor, and in terms of what services we're able to provide with the new contract. So state grants, we have been, certainly lobbying for systems like either Numo or something similar, senior transportation, to have better funding at the state level. So far, we have not succeeded in that yet, but we will certainly continue.
Okay,
So
yeah,
maybe people who are elected as state representative can help out with that.
Yeah, that's right. Do we have any candidates here? I don't think so. But
I
yeah, we
said-
do.
I
That's
said
right.
Bill.
There we go. See you. Sorry, in the corner. Yeah, okay, that's great. Yeah, I'll just I don't know if there's a point where we make formal recommendations, but at least my personal recommendation is definitely to continue funding and supporting Numo. Not just at the cost amounts, but at the service levels that we currently provide. Just knowing how that's such an important service that people really rely on.
Thank you, Councilor Mickler. Councilor Malcolm?
Thank you. Just want to follow up a little bit on the grant situation. Maybe continuing on Numo. I see in the FY 2025 request from the state is 350,000. That's DOT. When do we find out if we get that?
I think we're starting to get information on whether we think we're going to get it or not and how much. So we are certainly hopeful in the coming fiscal year to be able to still get one or two grants. And the larger grants, though, we're certainly trying for every grant possibility. Nicole Friedman from the Planning Department has been enormously successful in obtaining grants, and she's continuing that effort to this day. So I think we're going to find out soon, and we're having to make some assumptions about which grants we're going to get or not going to get in terms of our upcoming contract.
So that requested amount is not like one big grant, it's the sum of a bunch
Yeah,
of.
and multiple opportunities, yeah.
And if.
Dr. Maliki, it looks like Perry Roosevelt may want to.
Okay, does Perry want to say something?
Thank you, Mr. Chairman. Thank you, Counselor. So I just want to make note that where it says FY25 requested, Comptroller Steve Curley actually goes into all those accounts and looks at what is looking at prior history as well as what he knows is coming this year. What is the maximum amount that each of these accounts may use? And I believe he always errs a little bit higher just to make sure that we've requested the full amount from the council so that we wouldn't have to come back later in the year to request additional funding for these grants.
Good point.
Oh, okay. So, right, okay, so, so do not have to come back to request acceptance. Okay, I get that. And
Thank you, Perry.
if we should be successful in getting sort of the maximum number, which, and that 350,000 exceeds the budgeted NUMO amount of 275,000, would we be able to expand service or restore some service or bring on more drivers and cars?
No, so right now we're assuming a budget that's closer to $500,000 a year because we have the 275, we have some formula grant money from the state as well that goes through senior services. And then we also have, I think it's at least 190,000 in a state grant that we think is continuing, at least for another year. So we're also trying to find other grants. At one point, this program was costing over $1 million a year. And so that's when we had to scale it back considerably to more, really cutting that price tag in half. But so we're trying our best to come up with a contract and a new service that fits our revenue. So that's the reality. And we will, I think in the next couple of weeks, Mignon will be making an announcement, right?
Okay, so I think I misunderstood. So the 275,000, that only represents the money that the city itself is putting in, and any grants we receive would be in addition to that?
Correct. Yeah, and that's the way it's always been run. Yeah. The city's always put in the 275. That's the amount we used to use for taxis, before we created NUMO.
Okay, and did we get multiple bids on, when does the current
Yes.
contract expire and when?
Mignon, if you want to answer that.
The current contract is up, I believe, the end of June. We did get several bidders. I think no service is perfect for everyone, but there's some very exciting opportunities with this, new service that I think people will be interested in. But it more to come. But I don't want to say something that isn't completely accurate because we're still working out the fine details.
And it would still be called NUMO, but the provider might be different. Is that?
We haven't made that determination.
Oh, really? So it might even have a new name. Interesting. And
To
then
be-
Go ahead, Sue.
No, I'm sorry. I just say to be determined.
and the grant funded positions, are they, I saw also in the grant section, State Council on Aging formula grants. And again, the requested amount is about double of FY24. Is that something that it's predictable based on our number of seniors existing, or would we be able to expect a large jump from the state if we sort of are, say, from the expanded hours of the new senior center, something like that?
The formula grant is based off the numbers of residents who are over 60 as of the 10-year census. So the amount per person can go up or down. The state sometimes has to cut that, sometimes they increase it. It has been steadily increasing over the last several years. At the moment, we get $14 per older adult. And we have 22,700, I think, in 89 in the 2020 census. That is the current census they're using. So we get about $319,000 from the state for the formula grant, majority of which goes to pay for additional staffing that isn't in the municipal budget, and then a portion goes toward transportation, and there's some other contracts in there as well. There was good news this week that both the House and the Senate did have in their state budget that is progressing through an additional $1 to $15 an hour, $15 a senior instead of $14. So that would be, an additional $22,000 or so, but we don't have confirmation obviously yet because the budget has not been finished.
Okay, so basically that's a pretty stable amount because we know how the number of seniors is gonna be good for 10 years, and as long as they don't cut the per person, but increase slightly.
Historically, over the last 10 plus years, it's been pretty steady. Occasionally the state, obviously, they base their budgets on their revenue as well, and things can change there. But it is usually a very reliable source.
Okay, thank you very much.
Yep. I do not see any other hands.
Straw vote of approval.
Councilor Humphrey has moved for a straw vote of approval of the budget request, which is $929,560, unless someone corrects me. Any discussion? All right, all those in favor, please say aye.
Aye.
Any opposed? Any abstentions? 6-0. Thank you, Ms. Murray.
Thank you.
Committee members, we have one final item. I believe Mr. Siegel has joined us. Welcome.
Yes.
Please come sit with us. So this is item 200-24. This is the appointment of Donald Siegel to the Newton Housing Authority. Mr. Siegel, what we normally do is give you an opportunity to tell us why you are interested in serving in this capacity, why you're interested in joining the Newton Housing Authority. I'll then open it up. Council will have an opportunity to ask any questions they have, and then we'll proceed to a vote. And I'll explain to you where it goes from there, but let me give you an opportunity to tell us why you're interested. And thank you for coming.
Well, I'm interested, not because I'm an expert in housing. I'm not. I'm interested because I've lived in this community for 50 years. I raised 3 kids here. They were all educated in public schools. And I retired a couple of years ago after serving as a union attorney. And I have a little time on my hands. Not a lot, but a little. And I would welcome the opportunity to serve our community in some meaningful way. This is a meaningful way.
I would note that we have an opening in our law department for an attorney with labor experience.
I'm done.
If you're looking to, okay.
I'm done.
And Health and Human Services.
I had a great experience and have wonderful memories of being a union lawyer, but 50 years is enough. And I don't think I would do too well on the management side. I'd probably be much more generous than I should be and be in trouble very quickly. I'm interested in enriching the diversification of our community. I'm interested in enriching the quality of our housing stock and making it available to more people of more backgrounds than could otherwise be possible in the private market in the city where we live. We're fortunate to live where we live. There are a lot of people who would give anything to live here. And public housing does play a role in making that possible. Now, I do want you all to understand that the reason the mayor called me was the statute that describes the membership of the Housing Authority Board requires that one board member be a labor representative. The term is undefined. She knew me and knew of my interest in enriching our community. She called, and I'm happy to volunteer and to serve. I'm actually looking forward to learning more about public housing and the operation of the housing authority. And I am told by the executive director that there will be two very experienced, very expert members of the board who will be more than willing to, at least bring me up to speed relatively quickly. So I'm into it, if you want me to be into it, and I am happy to answer any questions that you may have. Sir.
Counselor Oliver.
Great, thank you, Chair. Thank you for your willingness to serve and to pitch in, because we'll take all the help we can get. And I think that, you mentioned you got a little bit of extra time. Hopefully, maybe a little bit more than just a little extra time, because there's a lot of work to be done. But thank you for your willingness to serve. I do have one question, however, I wouldn't direct this to you, and I don't know, Mr. Heath or anybody else who's here. I just realized you're being appointed for a 5-year term. Don't we normally do that for like 2 or 3 years at a time?
Actually, the first term should be 3 years.
Okay, and again, it's not for nothing, but I was like, wow, 5 years, that's a long time. I just picked up on that, like literally sitting here, so anyway, I was just curious if that was, I guess if that's.
Yeah, picking up on that as well.
So, okay, other than that, I'm very happy to support this, when the time is right.
Thank you. Councilor Roberts and Humphrey, let me just check out, in terms of the duration of that, do we need to amend the item?
We can vote to amend the item to have the end date be a 3-year instead of 5-year appointment.
Okay, do you want to check on what that?
I'm gonna check on
Okay.
that.
Thank you. Councilor Roberts.
So I want to second Councilor Oliver's thanking you for the willingness to serve on a very important group. I was curious about the labor piece, and is there a role for your expertise on the authority in regard to labor? I didn't know that,
Well,
if there is.
The term labor representative is not defined in the statute. And having never served on the board, I'm in no position to give you a really good answer. I'll tell you what my thinking is. I come with a labor background. I am sensitive to the needs of working people. Whether they work for the city, whether they work for contractors, whether they work for people who just work for third parties. If the housing authority is in a position where it is making a decision on something, and I can offer the perspective that my experience teaches me is important from the standpoint of workers, I'm there to share that. I'm there to bring my knowledge, my sensitivity, to the attention of my fellow board members. And they'll deal with it and we'll deal with it as a board. But I think the statute and the general court envisioned in preparing this, that this is a constituency that should be understood at least by the board in making its decisions.
Well, thank you as well, Mr. Siegel, for doing this. I don't think we've ever met, but you know, I'm your ward counselor. And I've always said that one of the big strengths in Newton is that we have so many retirees who are willing to step up in their retirement to serve in a civic capacity. And that's certainly very appreciated. And you know, coming from a union household myself, I certainly understand that, like you said, it's important to have that perspective in the room. Because sometimes there's nobody with that background and familiarity, and then, you know, there's misunderstandings that could be completely avoided because, you know, you have somebody that does have that perspective as part of that conversation. And also I wanted to thank you for your long service with the Mass AFL-CIO and various other labor roles. So I'm certainly happy to move this after we've dealt with the appropriate amendment, which is to a term of 3 years rather than 5 years, which was probably a relief to you.
What were you told?
I actually just read what you read.
Oh, okay.
So I'm fine with whatever the term is.
So should we just go with lifetime appointment?
Sounds good.
So is it 2027 then, Barney?
Yeah, that would be a 3-year term.
May 2027? Okay. So I'll acknowledge that. Other discussion? Okay, so I believe Councilor Humphrey has moved approval of the item as amended to, I'm sorry, to be amended for the term to expire on May 20th, 2027, which would be a 3-year term. Okay, any discussion on that motion? Do we know, did the AFL-CIO lobby to get that provision into the housing law that it be a labor appointment? Okay.
You know a lot of secrets when you're a lawyer and you can't disclose those.
Understood. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Okay, that's 6-0. What that means is that our recommendation goes to the full city council, which meets on the 20th. I would expect that the full council will approve it at that time, and then I think we're good to go.
Thank you very much.
You don't have to be there on the 20th.
Oh, yeah, thank you. And I do want to say one thing. First, Bill, it is a pleasure to meet you.
Just you. The rest of us can go.
No, it's a pleasure to be here and meet all of you. And of course, Alan, I've known for years. So I had an experience a few years ago where I served on a committee that reviewed your salaries or the salaries of your predecessors. And I spoke to several of the
Blue Ribbon Commission?
Yes. And I spoke to several council people who came to speak to the committee during its deliberations. And I did gain respect and appreciation for the work you do and the time you spend. And it is significant. And I'm assuming you all don't have as much spare time as I do. So I just want to add my thanks, that's all, to all of you for your commitment to the city.
Thank you. I know, I don't know if everyone else has, I've been looking for the resident who appreciates the work we do, so I'm glad we found you.
Yeah. Well, he's the one, he's the one. Maybe you want to increase my term then.
Thank you very much.
Thank you.
I believe that's our last agenda item. So we are adjourned. Thank you.
The meeting is ready.